Randy, I am glad you have come in this morning to discuss your upcoming procedure. It is normal for you to be apprehensive or having second thoughts.
Thank you, Doctor. I have been mulling this over, and quite frankly, the whole idea of having my nether region altered has me quite nervous.
Well, let me help put your mind at ease, Randy, by answering any questions you may have.
Well, first, Doctor, is it necessary to shave my package before I come in for my surgery?
Definitely shave. With a sharp razor, warm water and antibacterial soap. Shave your entire chest, arms, abdomen, and pubic area. If you have any genital or scrotal hair, shave it as well. Continue with your legs down to the ankles.
Is that really necessary? That would seem rather extreme to me.
Randy, this will make pantyhose and leotards easier for you to slip into. Many men find they develop a desire for soft, silky undergarments next to their skin after a vasectomy. Don't worry, this is normal.
Okay, cool. In fact, I sometimes have those desires already. When my wife is out of town, or with her bunco group, I sometimes wear her teddies around the house. They're quite comfortable. I like the feel of being shaved as well. It makes my guns look bigger. Will there be any females present during my operation?
No, Randy. All females will be behind a one-way mirror watching the procedure and discussing the size of your unit. Laughter in the operating room can be distracting for the surgeon. The attending nurse will be a large male nurse named Bruno. He is quite capable of handling a vasectomy patient and keeping them distracted during the procedure.
Good, I was afraid that having some hot nurses fondling me could result in some serious wound. I did have a friend named Big Harold, and there were times I felt strangely attracted to him. I'm looking forward to meeting Bruno. What are you going to do with the tissue that you will be removing from my scrotal area? You won't be using it for anything experimental as is common with fetal tissue, will you?
Definitely not. All tissue becomes property of the hospital and is consumed on premises. Favor bins and a white Zinfandel are optional.
Is it possible to just clip one of my testes and come back next week to complete the operation after I see how I feel, Doctor?
Randy, while it is possible to do one side and wait, the patient usually does not wish to come back and undergo the tranquilizer, darting, leather restraints and pre-vasectomy exam by Bruno more than once. Sometimes, patients do not return and must be hunted down, roped and vasectomized in the field, which is an unsanitary procedure at best. This could result in considerable loss of reputation with your neighbors.
Will this affect the appearance or elasticity of my scrotum, Doctor? My father-in-law, Big Dave, told me there is a possibility I might develop ball drop syndrome.
Well, I must tell you, ball drop or testicular prolapse can occur. It is easily managed by simply watching where you step when you are not wearing a support. If you do experience pain or discomfort in the operated area, look under your feet. One patient of ours who possessed quite large testicles, unlike your own, he is now gainfully employed each New Year's Eve in New York. He has turned his ball drop into an asset to be proud of.
Is there any possibility that my testicle may float away and lodge in one of my lower extremities, like an ankle?
What makes you think we plan to leave the testicles remaining in your scrotum? As I said before, all tissue becomes the property of the hospital.
Will this operation affect the tenor of my voice?
Not appreciably. It will, however, affect your pronunciation, causing you to pronounce syllables such as the TH sounds. This and limp wrists are possible side effects.
Will anyone be able to tell I have had the operation?
Not at all. We have taken the liberty of saving you the trouble and, upon receipt of your appointment confirmation, have notified your neighbors, employer, and the O'Fallon Police Department of your new status.
Will you be videotaping during surgery, like we did when the 2 kids were born? And do I have to pay for a copy?
Payment is not necessary, Randy. You will, however, be paid royalties following theatrical release according to Standard Actors Guild guidelines.
Sweet. Maybe with the royalty payments, I can let my wife quit her sewing to make extra money. I have to ask you, Doctor, is there any chance this will cure my problem with involuntary ejaculation?
Oh, yes. It will also prevent an erection as well as urine retention and even pimples. We advise you to acquire a reliable product such as Kimberly-Clark Depends undergarments.
I see. Are there any special ointments or salves that I can use post-procedure? My wife used vitamin lotions after her pregnancy.
No, but we would recommend copious administration of Yukon Jack, Captain Morgan, or Everclear along with castor oil the evening before your operation. Randy, I am impressed with your questions. Most patients are afraid to face the reality of their decision. I can see that you plan on being well prepared for your new life as a eunuch.
After the operation, does my wife need to continue on birth control?
Well, let's put it this way. Since consummation of your marriage will no longer be possible, yes. She should continue. A woman has needs that have to be met. Randy.
Good idea, Doc. After the surgery, will I be required to return to give a semen sample? Should I get it at home or wait until my next visit?
Heavens no. Not you worry. Nurse Bruno will be here to take care of that procedure. Of course you will receive royalties for that tape as well.
Do you think you could recommend a cup or splint device to help stabilize and provide a safe environment for my affected regions, doctor?
Well, we generally recommend that you curl up on the floor, hands between your legs gripping your pubic area as you writhe in pain. This affords the protection to the genital area without interfering with Bruno's post-procedure inspection. Any further questions, Randy?
Well, that should about cover it, Doc. Wait. There is one more thing. Is there any possibility that I will lose facial hair or grow breasts?
No possibility whatsoever. It is a certainty. We'll be looking forward to seeing more of you on your next visit. Don't worry. Everything will go smoothly.
Great. I feel safe putting my two little friends in your hands.